High blood pressure, also known as hypertension, is a serious health concern, but most people don't realize it often stems from a common vitamin deficiency. Today, we're diving into the connection between hypertension and a key nutrient your doctor might overlook, vitamin D. This isn't just about blood pressure, it's about the health of your arteries, the risk of plaque buildup, and calcium deposits. Let's break it down. If you have high blood pressure, your doctor should always check your vitamin D levels. Unfortunately, that rarely happens. Vitamin D plays a critical role in artery health, yet it's often ignored in favor of prescribing medication. The truth is, what many call essential hypertension, meaning high blood pressure with an unknown cause, is frequently tied to a vitamin D deficiency. Inside your arteries, there's a thin, protective layer of cells called the endothelium. This layer constantly responds to whatever's in your bloodstream, whether it's nutrients, sugar, or harmful substances. When you're low on vitamin D, that protective layer becomes vulnerable, increasing the risk of arterial damage. So, why is vitamin D so crucial? Here are 3 major reasons. 1. Anti-inflammatory power * vitamin D helps reduce inflammation, which can damage arteries over time. 2. Antioxidant protection * it fights oxidative stress, which can weaken your blood vessels. 3. Nitric oxide production * vitamin D boosts nitric oxide, a compound that helps arteries stay relaxed and open. Without enough nitric oxide, arteries constrict, blood pressure rises, and the heart has to work harder. Vitamin D doesn't just support arteries, it also helps your body absorb calcium. In fact, it increases calcium absorption in the intestines by up to 20 times, supporting strong bones and proper cellular communication. But here's where things go wrong without enough vitamin D. When calcium levels drop due to low vitamin D, your body activates a backup system, the parathyroid glands. These glands release parathyroid hormone, PTH, which pulls calcium from your bones to maintain stable blood calcium levels. Over time, this process leads to 2 serious problems. Osteoporosis * bones become weak and porous. Arterial calcification * excess calcium from your bones can end up in your arteries, leading to stiffness, plaque buildup, and hypertension. This condition, known as secondary hyperparathyroidism, often stems from chronic vitamin D deficiency. While doctors worry about vitamin D toxicity, research shows that deficiency is far more common and harmful. For optimal artery health and blood pressure regulation, vitamin D3 should be paired with 2 key nutrients. 1. Vitamin K2 * helps direct calcium into bones and teeth, keeping it out of arteries. 2. Magnesium * regulates calcium and supports proper muscle and artery function. Magnesium alone can prevent many cardiovascular problems by helping arteries stay flexible and responsive. The best source of vitamin D is sunlight. When your skin is exposed to the sun, your body naturally produces vitamin D3. About 40 minutes of sun exposure can generate 20,000 IUs of vitamin D. If sunlight is limited, supplementation may be necessary, ideally with vitamin K2 and magnesium. If I had high blood pressure, I would personally consider taking around 30,000 IUs of vitamin D3 daily, alongside K2 and magnesium, to help regulate calcium and support artery health. Of course, always consult your healthcare provider before making any changes to your supplement regimen. High blood pressure is more than just a numbers game, it's often a sign of underlying nutritional imbalances. By addressing vitamin D deficiency and supporting your arteries with K2 and magnesium, you can take proactive steps toward better cardiovascular health. Don't just settle for medication without exploring the root cause. Thanks for watching, and take care of your heart naturally.